Good morning all friends, myself Dr. Hilesh K. Diwan, MD Medicine, working in Rhythm Heart and Medical Hospital since 12 years. I have a lot of experience of diabetes and blood pressure patients and cardiovascular patients. I am doing regular 2D echo and TMT in my hospital. I have a daily 4 to 5 of patients of hypertension and diabetes or new patients. We are visiting in KD Hospital, Apollo Hospital and nearby SGVP Hospital too, and we are running critical care patients in our nearby ICU setups. Today we are going to discuss regarding hypertension. What is hypertension, how to prevent it, what are the causes and what are the symptoms. So initially the hypertension was known as a increase in blood pressure of systolic more than 140 and diastolic more than 90. So let's first understand what is hypertension. Normally the heart pumps and it ejects the blood into the blood vessels, that causing the pressure on the lateral wall of the vessels. This pressure is called as a blood pressure. The blood pressure was not fixed throughout the day. It will rise and decrease throughout the day, during the night time, and according to the situation. So whenever there is a situation arises where the blood pressure is more than 140/90, then it is called the hypertension. The hypertension is not a disease, but it is a risk factor for the cardiovascular and cerebrovascular morbidity and mortality. The hypertension is basically a complication of many things like renal and eye diseases also. In the day-to-day practice, we have seen many patients of hypertension. So first and foremost question, what is the symptoms? The symptoms are more or less very much low. So hypertension is called as a silent killer. But sometimes the patients have a symptoms like headache, giddiness, lightheadedness, chest tightness, insomnia, or exaggerated all the things, fatigue. These are all the symptoms. Now how can we study the blood pressure or measure the blood pressure? The diagnosis of the hypertension is seen whenever the patients have a symptoms, so they go for the checking of the blood pressure, and if it is higher than the normal, then we say that this patient is having hypertension. Without measuring the blood pressure we cannot see. So it is must to measure the blood pressure each and every patient who have a symptoms, or regularly after 40 years of the age. Now what are the causes of hypertension? The primary cause are genetic in origin. There is no cause found. So it will occur in a patients who have a age more than 40, who have a disturbed lifestyle, that is physical inactivity, higher level of the stress, consumption of the smoking or high consumption of the alcohol, those who have increased salt intake, or those who have increased saturated fat and cholesterol level in their body. So these are all the things which we understand that causes and the symptoms of hypertension. Now most important question, how we can prevent the blood pressure? So prevention of the blood pressure is more important in a patients to prevent the cardiovascular, cerebrovascular, kidney and eye related complications. So there are the 5 most important things to prevent the hypertension. The first is regular exercise. Second is diet, that is DEST diet. Third thing, quit smoking and quit alcohol. Fourth thing, regular adherence to the medications. Fourth thing, reducing the stress and anxiety, and regular blood pressure monitoring. Now the first point, how we can prevent the blood pressure by regular exercise. Regular exercise per day will increase the pumping of the heart. Increased pumping and strength of the heart will improve the blood vessel, that decreases the atherosclerosis. So regular exercise is must. Consistent exercise per day like jogging, swimming, running, that will decreases the blood pressure and prevent the blood pressure occurring. So 30 minutes a day, that is 150 minutes per week, exercise is must in each and every individual. Second thing, diet. Diet is rich in green leafy vegetables, salads, that are improve and prevent the occurrence of the hypertension in the patients. So the diet pattern which we know in hypertension is called DEST diet, that is dietary approach to stop the hypertension. How can we stop the hypertension in a patients with prehypertensive or hypertensive? Let us understand. First is decrease the salt intake and increase the DEST diet, that is increase green leafy vegetables, whole grains, decrease the salt intake, increase the potassium diet, and moderation of the calcium diet. So taking the green leafy vegetables, salads, fruits, whole grains, and decrease the intake of saturated fat, decrease the intake of cholesterol diet, that all are important for the decreasing the occurrence of the hypertension, as well as in a patient with hypertension they will decrease the dose of medicine. This diet will improve the blood pressure in a patient with hypertension around 5 mm of systolic and 3 to 4 mm of diastolic blood pressure. Second thing, salt intake. We should decrease the salt intake to less than 6 gram per day, and ideally we should maintain our body weight to 25 kg per meter square of BMI. So salt intake in each and every patient you should decrease to 6 gram per day in a hypertensive patient. Now how the salt goes in our body? The processed foods are having high amount of the salt. So whenever you go for purchasing food, you should check for the label that which amount of or how many amount of the salt are present in the processed foods. If you decrease the processed food in your diet, that will definitely decrease the blood pressure to occurring in your body. So decreasing the processed foods and increasing the calcium diet and potassium diet will definitely causing decrease in the hypertension. Now what are the potassium diet? The green leafy vegetables, tomatoes, the coconut water and other citrus fruit like oranges, guava, etc. They have a high amount of the potassium in that. So that high amount of the potassium will decrease the resistance of the vessels and increase the flexibility of the vessels, that will decreases the blood pressure. Now what is the calcium diet? Moderation of the calcium diet in a patient with milk products, they will decreases the blood pressure, have a minimal load. Now the fourth thing is quit smoking and quit the alcohol. If you are decreasing the smoking or quitting the smoking, will prevent the occurrence of the hypertension, or they will regularize the blood pressure in a patient with already having hypertension. Even quitting the smoking is very important in a patient with decreasing the cardiovascular risk and death. Hypertension in a patient with alcohol have a isolated systolic hypertension, and that those having a increased chances of the hemorrhage in their brain. Third thing, regular blood pressure monitoring. You should check your blood pressure regularly. Normally it is not possible for each and every patient to go into the clinics of physician's clinic for checking the blood pressure. So what to do? So self monitoring of blood pressure is very important in each and every patient. The advantages are regular blood pressure monitoring at home or at different occasions, while during night or during some occasions, that will have an idea that these patients have this type of recording of blood pressure. So self monitoring of blood pressure checking is very much important in a patient with hypertension, and they have a recording for that. So we have to change the medication, or we have to increase the diet in that patients. The fifth thing, stress management. By learning how to relax and manage the our stress is very much important. Stress relaxation in the form of biofeedback, yoga and meditation is very much important in each and every hypertensive patient. You should sleep adequately, you should maintain your diet, you should have focusing on something that is calmful or enjoyable to you, that is more important, and that patients have decreased the hypertension occurrence, or hypertension have already reduced in that patients. Fourth thing is adherence to the medicine. How you can control your blood pressure. Whenever the patient is having a grade 1 or grade 2 hypertension and they are on the medicines, so they should adhere to their medicine. Most of the time we have seen that hypertensive patients, they stop medication by themselves. They feel that I have a normal blood pressure and why should I take medicine? No, it is nothing like that. You should continue the medicine as much as your physician have told you to decrease and gradually withdraw the medicine. Otherwise you should continue with that medicine. Self withdrawal of the medicine is one of the most causes of increasing the blood pressure in that patient. So for overall the scenario of hypertension, how you can prevent: enjoy your life, be cool and calm, give your time to yourself, and give stress reduction, and as I have said that prevent the blood pressure by regular exercise and adhere on to the test diet. Lastly, nothing more than the life if we have our fit and healthy. So if you have any query regarding the blood pressure, or if any query regarding the diabetes, then please call us on or contact us. Thank you so much.